Buenos dias! Today we will be talking about a pathogen called West Nile virus. The most frequent mode of transmission is by mosquitoes. Birds are natural hosts of West Nile virus, and the mosquitoes will get infected after feeding on these infected birds and circulate the virus in their blood. Then the virus can be injected into humans and animals from the mosquito. However, according to the Center for Disease Control, there are very small cases of this virus being transmitted through blood transfusions, organ transplants, exposure in laboratory setting, and from mother to baby by breastfeeding. About 1 in 150 infected people develop neuroinvasive disease, which is the more severe symptoms caused by West Nile virus. Mortality is uncommon. However, increased age leads to an increased risk for neurologic morbidity and mortality. In the United States in 2013, a total of 2,469 cases of West Nile virus disease in people, including 19 deaths, were reported to CDC. About 50% of the people who were affected, specifically 1,267 people, were classified as neuroinvasive disease, and the other half were classified as non-neuroinvasive disease. This pathogen originated in the West Nile district of Uganda in 1937 and then spread to Europe in the 1960s. The first North American report was in New York City in 1999, and it now has widespread distribution. Now, the virus is commonly found in Africa, Europe, Middle East, North America, and West Asia. 70 to 80% of people who become infected with West Nile virus don't develop symptoms. However, about 1 in 5 infected people will develop a fever with other symptoms including headaches, body aches, joint pains, vomiting, diarrhea, or rashes. This form of the West Nile virus is a febrile illness, which means that it is marked mainly by a fever. These people will recover completely, even though their fatigue and illness may last for weeks and even months. Less than 1% of people afflicted who get the most severe symptoms will get neurologic illness, such as encephalitis or meningitis, which is marked by inflammation of the brain or surrounding tissues. There is no vaccine available for humans, although there is a vaccine for horses. Hospitalization, intravenous fluids, respiratory support, and prevention of secondary infections are all important with treatment and care for patients with neuroinvasive West Nile virus. Since there is no vaccine for the virus, the risk of being infected is reduced by raising awareness and educating people about how they can reduce exposure to the virus. Mosquito nets, personal insect repellents, and wearing light-colored clothing, specifically long-sleeve shirts and trousers, and avoiding outdoor activity by peak biting times are important in prevention. Stay safe, folks.